Good afternoon. I'm Dr. Jay Crook. I'm a cardiologist and the Vice President of the Heart Lung Vascular Institute at UT Medical Center. I'm very happy to speak with you today about our upcoming HEARTWISE event, which is Saturday, February 26th. It's at the Heart Lung Vascular Institute here at the University of Tennessee Medical Center campus. It's 7:30 a.m. to 12 noon that day. February is American Heart Month, and I want to emphasize the importance of prevention. We would much rather prevent a heart attack or a stroke than treat a heart attack or a stroke. And so the focus of this program is to educate you on ways that you can reduce your risk of having a serious heart or vascular event. We have several programs that we offer. We have a comprehensive cardiovascular risk screen, which involves some blood work. So come fasting, but we'll feed you breakfast after you're done. We check your cholesterol, we check a fasting blood sugar, we do an EKG to screen for a heart rhythm called atrial fibrillation. We do an ultrasound of your carotid arteries, which are the arteries, major arteries to your brain, to look for plaque. Artery that runs through your abdomen to look for an enlargement called aneurysm. We also have an option to do a test called a cardiac CT coronary calcium score. This does not involve an IV or the use of any IV contrast. And this is a CAT scan of your heart that shows evidence of plaque that can give a clue as to the amount of plaque that may be present in your heart arteries. We also have a nutrition class to work on heart healthy eating and tips for that. We also have various educational programs, including early heart attack recognition and some brief instruction on hands-only CPR, as well as early stroke recognition and some advancements in cardiovascular care that we have had here at UT over the last few years that are now available. We also have resources to help folks stop smoking. In addition to all this, cautiously with masking and social distancing, we ask that you call to make an appointment. The phone number is in the link, and you can schedule the various types of exams that you may want to schedule for a screening test while you're here that morning. In addition, if you have not received your COVID vaccine or a booster, those will also be available. You do not have to make an appointment for those, but we do ask you that you make an appointment for the other services so that we can adequately prepare to do this in a safe fashion. So we're very excited. We do this event annually. We had a brief pause last year because of the pandemic, but very excited to be able to offer these services again this year. Again, the idea being prevention. And prevention and screening tests, we know, have dramatically decreased during the pandemic. And we've seen a lot of people that have missed regular screening appointments, either with their primary care doctors or other health screenings that have led, unfortunately, to some unfortunate diseases that have progressed beyond the point where they normally would have been caught. So we certainly want to encourage people to re-engage in terms of their health screenings, and this is part of that in terms of your heart. Also want to emphasize overwhelmingly the importance of a healthy lifestyle to reduce the risk of heart disease. Our main focus is trying to help educate people and how we can find evidence of any atherosclerosis at an earlier stage before it causes any significant damage, because the great majority of heart disease is actually preventable. And that prevention comes through a heart healthy lifestyle with maintaining normal body weight, avoidance of smoking, getting regular exercise, eating a healthy diet, and then treatment of high blood pressure or diabetes, high blood sugar, or high cholesterol if you have any of those conditions. And if we do all of those things, we can greatly reduce your risk of having a heart attack or a stroke. And so we're happy to take any questions if any of them happen to come through.
Yeah, thank you, Dr. Crook. We did have one question about the screenings. Is there a cost associated, or could you?
So these are much reduced costs compared to normal. There's a $35 fee for the comprehensive cardiac risk assessment, which includes the ultrasound exams that I mentioned, as well as the EKG and the blood work. So that's a $35 fee. If you elect to do the CT scan, that's a $99 fee for the coronary CT scan.
And thank you, and we had one question. Somebody jumped on a little bit late. asking where in the medical center is this event?
So it's at the Heart Lung Vascular Institute, which is Building E, Heart Lung Vascular Institute at Building E on the UT Medical Center campus. There is free parking available in Parking Garage 4. It's right off of the flag circle as you come into the main entrance at UT Medical Center.
Great. And then just you had mentioned about with COVID, just screenings have been impacted. Maybe speak to that with the February being Heart Month and why it's so important.
So again, what we would very much want to do is catch evidence of atherosclerosis or evidence of heart or vascular changes at a very early stage before that someone's actually had an event with a heart attack or a stroke. And we can detect evidence of early atherosclerosis via some of these screening tests that we're offering. And then it is extremely important that we really work hard to modify risk factors. That's why we do the blood work, because cholesterol and blood sugar are critical components of trying to reduce risk. And then also, again, emphasizing healthy lifestyle with, we have a nutrition class, which is going to be great to help folks learn how to shop in a healthy way and prepare foods in a healthier way. And then also to, if you are a smoker, to help try to stop smoking, because doing all of those things can dramatically reduce your risk of having a heart attack or a stroke.
Great. I have another question that just came in about the coronary calcium score. Could you just maybe explain that, what that is?
Absolutely. So this does not involve an IV or any contrast, and this is a low radiation CT scan, basically just of the area around your heart. And calcium can show up in your heart arteries as evidence of plaque. The old term hardening of the arteries, the hardening is actually calcification. And that does not mean, by the way, that you shouldn't drink milk or take calcium. But calcification is reflection in the arteries of a disease process called atherosclerosis. And with that CT scan of the heart, we can actually quantify the amount of calcium that you have in your heart arteries, and we give it a score. And there's a score ranges, and the higher the score, the higher the risk. The best number is obviously 0. We love the zeros. But anything under a 100 is typically a lower risk score. If you have a higher risk score, by the way, it does not mean you're a ticking time bomb. You've not had a heart attack, you've not had an event. What we would like to do is, if you have a higher score, is know that before you have an event so that we can institute measures that can reduce your risk of having a heart attack. So the calcium scoring is an objective way to quantify the amount of plaque in your heart arteries, and it gives you a score that helps guide us and what the next best steps of management would be.
And the person that sent that question says, thank you. And then one follow-up, can it predict blockage?
Excellent question. So plaque is not necessarily blockage. Plaque can lead to blockage. Most arteries, in the early stages of atherosclerosis, it occurs in the wall of the artery. So if you think of the artery being like a pipe, a lot of times the early plaque is in the wall of the pipe. And what we want to try to do is prevent it from eventually narrowing and blocking off the pipe.
Right.
From a calcium score, you cannot tell whether that plaque actually blocks the artery, but we can tell the amount of plaque you have, which gives us an idea of the likelihood that you would have a blockage, okay? And again, the main focus here is on prevention. And so if you come and if you have a 0 coronary calcium score, you have a less than 1% risk of having a heart attack in 5 years. If you have some degree of calcification, again, it does not mean you're a ticking time bomb, but it does indicate that we need to talk about measures to reduce your risk, potentially through medications called statins to reduce cholesterol and other measures to reduce risk of heart attack.
Wonderful. Several questions coming in. A good one. At what age should someone participate in some of these screenings that are available?
Another excellent question. So in general, it depends to some degree on your level of health and your family history. Folks that have a family history of heart or vascular disease, especially at young ages, I would encourage you to seek evaluation and screening at a younger than typical age, typically 5 to 10 years before the first event would have occurred in your family. Certainly, everybody over the age of 40, I would recommend have an annual cholesterol check as well as an annual blood pressure check. For these types of screenings in terms of the coronary calcium scores, Typically, the sweet spot for this is men who are about in their late 40s to 50s, women who are in their 50s to 60s. Not that you can't get one at another stage. Again, if you have a family history, I might encourage that to be earlier. Someone that has had a sibling or a parent have a heart attack at a younger age, I might recommend that at a younger stage. Certainly, again, blood pressure and cholesterol screenings, I think, for everybody once you're approaching 40 or above. But if you have a family history, we need to be much more aggressive. And then in terms of the screening stuff, typically men in their mid to late 40s and beyond, women in their mid 50s and beyond.
Great. And then one question about, you did say they need to fast for some of these screenings.
So just for the comprehensive cardiac risk assessment,
Okay.
which will involve the blood work, which is the cholesterol and the blood sugar, for that package of testing, we do recommend fasting. Also, the abdominal ultrasound is better. But again, we'll feed you a heart healthy breakfast after you've had your testing.
Wonderful. Well, thank you so much for your time. No other questions here. Maybe just wrap up with the info about the.
So again, it's Saturday, February the 26th here at UT Medical Center at the Heart Lung Vascular Institute, Building E. Free parking available. It's from 7:30 to noon. Again, please call in advance to make an appointment, and the phone number is in the link.